Okay, we're going to learn about joints now. First, we're going to go through the classification and structure of joints. So we have three different classifications. We have synarthroses, which have no movement. Then we have amphiarthroses, which have a little bit of movement, and then diarthroses, which have free movement. So this is like your synovial joints, your shoulder, your hip, that kind of thing. So with the synarthroses, these are classified with no movement. Okay, so we have fibrous joints. Two of those are suture. So this is the sutures, like in the skull. Okay, so it's the joint between two bones of the skull. And then we have gomphoses, which gomphoses is a synarthrosis where the teeth go into a bony socket in the maxilla or the mandible. And then we have cartilaginous synchondroses. So this is where cartilage attaches bone to bone, okay, like in our sternum, our ribs, so synchondroses. And then we have the synostosis, which is like a bony fusion. Okay, this is where we have, so this is the frontal bone, the synostosis, where we have, when we're real little, when we're an infant, we have a metopic suture in the middle of our frontal bone here, but then it completely ossifies over and fuses. So there's not even a suture there anymore. So that's the synostosis. Okay. And then we have the amphiarthroses. There's two different examples of that, the fibrous and cartilage. The fibrous one is a syndesmosis. So this is like at the distal portion of your tibia and fibula. You have a small degree of movement where the ligaments connect the distal portions of the bone. So there's a slight movement. And then cartilaginous is the symphysis. So we have that fibrocartilage disc in our pubic symphysis, which allows for a little bit of movement, but not much. Okay. And then the diarthroses is our synovial joints. Okay, we have our monoaxial, which is one plane of movement, like our elbow. It just flexes and extends. And we have our biaxial. Okay, this is like on our ribs or at our wrist. We have two planes of movement. And then triaxial, which is three planes, which is our hip and shoulder, the ball and socket joints. Okay, so we'll look at those. So the basic structure of a synovial joint, we have the periosteum, which is continuous with the fibrous joint capsule. Okay, and below that, we have the synovial membrane, which produces the synovial fluid within the joint cavity. Okay, that's that space in here. Then we have the articular cartilage, where the joints articulate. And then we can have ligaments on the outside of the joint capsule or within the actual joint cavity itself. So example of that is in the knee. We have the extracapsular ligaments like the patellar ligament. We have the intracapsular ligaments like the cruciate ligaments, the anterior cruciate ligament or posterior cruciate ligament. For that. And then we also have parts of the joints. We have bursas. These are little kind of like water, like little pads that help reduce friction. Okay, so a lot of times you'll find them under tendons or where there's a lot of friction. It'll build up a bursa to help decrease that friction with that. So when we talk about joints, we need to talk about movement. So with flexion extension, it's pretty obvious. Flexion, you flex your elbow, flex at your elbow, bring your forearm up. You flex at your shoulder, you bring your whole arm forward. You flex your head forward. You flex your hip forward. Flexion at the knee actually happens when you bring your heel up to towards your buttocks. But extension, it happens when we go from a flexed position to a neutral position. So we extend back to our neutral position, and then hyperextension happens when we extend further past that neutral position. Same thing with the hip. If we have our leg in a flexed position, we extend back towards the neutral position and then hyperextend past that neutral position. So it's flexion extension. With abduction and adduction. Abduction is where you bring the body part away from the midline, away from the center. Okay. Adduction is where you bring the structure back towards the body or add the structure back to the body. So abduction is away, adduction is towards the body. So basically shoulder and hip, and then you can do that with your wrist as well. With your fingers, it is in relation to your third digit here. So you or each digit to each other, I guess, to where you add them together, you bring them close together, and then you abduct them away from each other. Okay, so you separate them is abduction, bringing them together is adduction. Okay, and then with your shoulder has a unique movement called circumduction, okay, where you add several planes of movement together to get the circumduction. Because it's a shallow ball and socket joint. So the different types of joints we have in our body, gliding joint, like the one at the clavicle and the manubrium here, or like at your sacroiliac joint, where you have two pretty flat surfaces, okay, they just kind of glide back and forth over each other. And we also have a hinge joint, so this is like our elbow, all right, and our knee, where we just hinge, flex, extend, okay, there's one plane of movement. A pivot joint, at the atlas and axis. Okay, we looked at this with the axial skeleton, where the atlas is around the dens here, so it rotates and pivots, allowing you to rotate your head. So it's a pivot joint. You have the ellipsoidal joint. So this is your wrist joint, where we have two planes of movement. So your scaphoid and your radius allow for two planes of movement. Then you have your saddle joint. This is with your trapezium and your metacarpal of your thumb. Okay, so it allows you to shift like it's a saddle. Okay, so a saddle joint, and then ball and socket, which is your shoulder joint, your hip joint, allows for more free range of motion and three different planes. Okay, again, some more movement. We have rotation, head rotation, and left rotation, right rotation. And then you have, like with your shoulder, you have external or lateral rotation, where you rotate your thumb outward. And then when you rotate your thumb inward, your palm back, that is medial or internal rotation at the shoulder, okay? But if we keep the shoulder steady and we rotate at the elbow, okay, this is not called rotation, but it's called supination and pronation. So supination, we have the radius as lateral, so palm up, okay? And then we have, when we bring the radius over the ulna, we have pronation, okay? So I was taught if you are carrying a bowl of soup, you're in supination, okay? If you're holding the bottom of a bowl, your palm is up, holding the soup. So supination is bringing your palm up, and then pronation is palm down or palm back, okay? Pronation. So that's that movement. We have movement of the jaw, elevation, where you bring it up, depression, where you bring it down, protraction, where you protrude it outward, retraction, where you bring it back, retraction. Inversion and eversion. So inversion, you're going to bring the bottom of your foot medially. Okay? Inversion, you invert it, and then eversion, you bring it laterally. So inversion and eversion. Dorsiflexion, where you bring your foot towards your shin, basically, bring it up. Dorsiflexion, so toward the dorsum of your foot. Dorsiflexion, and then plantar flexion towards the plantar surface of your foot. Okay, dorsiflexion, plantar flexion, and pronation, supination, and then opposition. Opposition is where you bring, basically, well, this one shows your fingers to your thumb. True opposition is your pinky to your thumb, your pinky to your thumb. You can oppose these two. So that's more movement. Okay, so we'll get into some of the actual joints. We start in the spine. We have a couple different ligaments here. Again, we have intervertebral disc in between the vertebral bodies. So we have your vertebral end plates, then your annulus fibrosus, which is the fibrous surrounding tissue around this nucleus pulposus, which is kind of like a jelly. Okay, and then we have some of the ligaments. We'll start in the front, which is your anterior longitudinal ligament. So anterior in the front, longitudinal, we'll longitudinally, it runs longitudinally, and then it's a ligament. Anterior longitudinal ligament, okay, we have your posterior longitudinal ligament on the posterior aspect of vertebral bodies that runs longitudinally. Then you have your ligamentum flava, which is ligaments between the lamina, and then you have the interspinous ligaments and the supraspinous ligaments between the spinous processes and then over top of each of the spinous processes. Okay. And then we'll go into the elbow. Elbow, pretty simple. The main one you need to know is the annular ligament. Okay, this is where the radial head can pop out from this ligament here. That's called nursemaid's elbow. So when your kid is holding your hand and then just like drops dead weight to the floor, and this pops out of this little ligament, that's where the radial head pops out of this annular ligament. Okay, and so there's an easy fix to that. You just move the arm. You can look it up on YouTube on how to fix it, but that's nursemaid's elbow. Then you have on the lateral side, you have the ulnar collateral ligaments, and then on the medial side, you have the radial collateral ligaments. Or I'm sorry, vice versa. Lateral side is the radial collateral ligaments. Medial side is the ulnar collateral ligaments. I think I said it backwards the first time. Then we'll go to the knee. So the knee has a lot more of them ligaments in here. We talked about in the last PowerPoint, we said the quadricep tendon is from the quadricep to the patella, and then from the patella, so that's muscle to bone, that's why it's a tendon, and then patella to the tibial tuberosity is a patellar ligament. Okay. You have the fibular collateral ligament on this side. You have the tibial collateral ligament, so medial collateral ligament, lateral collateral ligament. Then you have internally, you have anterior cruciate ligament and posterior cruciate ligament. So the anterior cruciate ligament prevents anterior movement of the tibia. Posterior cruciate ligament prevents posterior movement of the tibia. And then you have your medial and lateral meniscus. Okay. And then in the back, you have popliteal ligaments and that's basically all you need to know. Popliteal ligament in the back, and then the internal ones there. Okay. So that's the knee joint, so just know some of those, whatever's labeled on that. Those little boxes, that's fine. And then you have your shoulder joint. So with the shoulder, you have your glenoid cavity in here, and then you have your articular capsule, which runs around here, and then you have your glenoid labrum. Okay, this is the fibrous portion here that helps keep your shoulder in the joint, basically. It's a real shallow, see how shallow this bony portion is? It's really shallow. You have this labrum that comes out a little bit and helps to form more of a cup to allow for that to kind of stay. Then you have your articular capsule, synovial membrane in there. You have the capsule down here as well. Yeah, and then you have some ligaments between each of these landmarks here, the acromion and the coracoid process. So it's the coracoacromial ligament. And then you have your acromioclavicular ligament. And then you have your coracoclavicular ligament from your coracoid process to your clavicle. Yeah, so know that. And then, yeah, those are all the ones you need to know with that one. All right, and then your hip joint. So the last one here is, so we have the acetabulum. Okay, we have the acetabulum, and then we have the transverse acetabular ligament over that acetabular notch. Okay, and then there's the ligament for the femoral head, so that helps keep that head in that joint. And then we have 3 different portions, ligaments that wrap around the whole joint here. So iliofemoral from the ilium to the femur, ischiofemoral from the ischium to the femoral, and the pubofemoral to the ischium, from the pubis to the femur. Okay, so there's 3 different aspects based on where it attaches to the specific bone in the pelvic girdle. Okay. So that's a quick review of joints. So just kind of know what we went over. Definitely look over the classifications is the main part, and then we may show you some of the picture to label some of the ligaments or something for the practical. And you should definitely know these movements, especially if we're looking at muscles next, to know flexion, extension, that kind of stuff, because you need to know the action of specific muscles too. So, all right.